My name is Dr. Roberta Woodgate, and I'm a professor at the College of Nursing at the University of Manitoba. I worked with a number of researchers and practitioners on a study that aimed to understand how families of children with complex care needs participate in everyday life, and their needs involved a variety of needs, including physical, behavioral, and other disabilities. Stigma continues to impact many of the families we worked with on this project. Families told us repeatedly about feeling of a lack of understanding from others in society. Families described the constant pressure of feeling like they are being stared at, or feeling like they are being judged, or even feeling like they were an outsider. Can you imagine what that feels like? And yet, as we have seen, the support from friends and family makes such a difference to them. If only others knew the joy that these children bring to the lives of those around them.
Like, just things that would help people understand me more is, like, yeah, my disability will affect some things I can do, but there's no need to, like, change plans or change the way you treat me just because of my disability. I haven't felt like an outsider just because of the, like, huge support that my family's given me, as well as, like, the close group of friends, so they've been super supportive. I can do pretty much anything the same as you, just a bit differently or a bit slower, but...
Daniel can't walk that far. If we're going into a mall or going into a store, he can't walk from the end of the Walmart parking lot. People sitting there and they say, oh, we're just waiting for someone, we're not going to be long. Well, we can't get in.
You just need a space that's close, and they just kind of take advantage of stuff like that. So people don't see it, and I think you have to walk a mile in someone or on their crutches or in their wheelchair to figure it out. When Daniel was younger, we would go out, and I remember other kids or even grown-ups, which it bothered me a little bit more when it was grown-ups. Look at him like something's not right. And you know, Daniel, I mean, he was very mature about it too. We talked about it, and I said, you know, people don't understand. You know, you're different. They're curious. They might have questions. Little guy or little girl come up to him one time to say, why are your arms like that? And so we had this dialogue, and I said, you know, you can tell them. Like, if you feel comfortable, you can say, I was born that way. And I remember him saying that to when they did ask him that. And as he got a little bit older, though, he was a little more annoyed with grown-ups who would kind of look at him, and he would say, I'm giving him the death stare. But I mean, he didn't mean it, but it was just out of ignorance, understanding. People are just curious, and it's harmless. You know, they've never said anything negative to him. So yeah, it doesn't feel good, but you understand that they don't understand.
If only people knew how rewarding and fulfilling it is to raise a special needs child. The rewards far exceed the stress and the worry. I don't think in general people can understand just how draining it gets changing diapers 5 or 6 times a day for 20 odd years. It's not something you really want to share with people either, but that's an aspect that no one really thinks about. A lot of people will avoid you. Even family members, you don't see as much of them. There's sort of almost a sense like they're afraid their kids might catch a disorder or something. And the other group that sort of irritates me a little bit are the ones that think that we have such a horribly hard life, we couldn't possibly be having a good family life or a good time. And that's not to say we don't have rough patches, but Dean is a wonderful kid. He's happy 99% of the time. And I see parents with quote-unquote normal teenagers, and I think, boy, oh boy, do you have it rough. For the most part, I find little kids seem to be way better with special needs than any adults. Little kids will come up to you and say, what's wrong with him? To me, that's a lot easier to deal with than people acting like he's not even there or that there's nothing wrong with him. If someone wants to ask us questions about Dean, if they're polite and you know, actually care, we're very open to it.
In our case, with the 3 children all born so close together, it was really just that we were getting into the depths of trying to understand where Beth was and getting diagnoses and taking her for various kinds of therapy appointments. became very hard to try and keep up with our normal lives. People didn't seem to understand why it was so difficult for us to get around and do the things that we used to do.
Probably where it most stood out was when Beth became school-aged, and you'd be in the schoolyard with the other parents and they would be discussing their child is participating in this sport or this activity, or they were planning play dates, and I knew Beth would never be included in those situations. I think that was the worst, was that feeling of isolation, because I never really got to know the other parents because Beth was never included in that circle.
It's very easy to look at a child like Beth and just sort of say that she probably can't do very much, but she has some tremendous capabilities. She's wonderful with young people. She goes and volunteers. Even this morning she was at the YMCA, took her own bus to get there. Well, I mean, taking the bus is one thing, but having the gumption to get up and go to the Y and on her own time just to go and see the kids and participate in that. How much she cares about her family, you know, even if her brother and sister knew how much she cares about them, I think they would be a lot kinder and a lot more patient with her.
With Beth's condition, you can't really tell from afar that she has the special needs. So you might think, oh, she's just really, really weird. But they don't really understand that she's maybe at the learning level of somebody who's in grade 2, but she can still communicate like somebody her age. When you don't know what she has, it's also difficult to explain it to other people. Like my teammates this year, I said I had 2 sisters, but I would only really talk about Mary, so I don't think I ever talked about Beth once because it's just too difficult and people maybe pity you or do that. So if they're never going to see Beth or Mary, I just don't really ever mention her. There is definitely a kind of a stigma attached to it. Like it's if they wanted to, they could change it. People don't really get that they're stuck like that. It's not their fault. It's not anyone's fault. They're still people too, and they're just doing the best that they can.
People are often afraid to approach Mary and they don't know how, and I don't blame them, because you know what, if I see someone with another special needs child, I may not know how to approach them, what might frighten them, what might encourage them, what might set people off. You don't know. I think, as in most things, whether it's race or gender or disability, fear and uncertainty is what hold us back. And then there are just some people who don't get it. But I think usually it's fear. And so that if you can teach them that it's okay, you can approach her, you can talk to her, they just want to know and they want to understand.
Lots of people don't realize that there's probably a lot more going on inside Mary than she shows. She certainly understands more than a lot of people would give her credit for. And if people can get in tune to that, it helps out dramatically, not just Mary, but it helps us. And it helps them. Yes, is that right?
Yeah. If only people knew how wonderful Mary was, and although they may not think she's much of a quality of life, she brings such joy to so many of the people that work with her and her family. But how could you have a clue if you didn't know? That's not their fault.